At RB, we value responsibility. This means doing the right thing, even when it's hard, to ensure the safety and well-being of our staff and customers. There's a reason our brands are trusted all over the world, because we hold ourselves to the highest possible standards in everything we do. It is our responsibility to ensure that our products are safe and that consumers are able to make an informed decision before taking our medicines. That's why it's essential that our labelling, leaflets and summary of product characteristics are all current and compliant. And that is where the CCDS, the company core datasheet, comes in. Let's remind ourselves of what's involved. The CCDS is an internal document that outlines RB's safety and medical opinion on the use of a particular active pharmaceutical ingredient. For every medicine that RB has registered, there is a corresponding CCDS. It contains information that directs the use of our medicines, such as posology, contraindications and side effects. Data that drives the CCDS is collated by a specialist team of medical writers in the Global Core Safety Group. External data sources and legislation are continually monitored to ensure that RB remains in line with current global safety expectations. Agreeing the content of the CCDS is a cross-functional effort between LRA, GRA and GCSG. This is to ensure that it works for everyone, balancing business needs with our safety-first approach. Any changes to the CCDS are communicated to LRA teams promptly, and it's important that changes to product information are made promptly too. RB has committed to submitting the necessary variations to health authorities within 6 months of CCDS sign-off. GRA and LRA work closely to ensure that we prepare variations, submit them to health authorities within 6 months and receive approval as quickly as possible. This may include responding to questions or providing further data. Once approved, the new safety wording is implemented on the artwork to ensure that products on the shelves are compliant. This is of course a simple overview of what's involved. Further details can be found in the new CCDS process SOP. All regulatory teams should take the opportunity to read this and direct any questions to ccds.globalregulatory@rb.com. We envisage an RB where compliance is a natural part of everything we do. To help make this a reality, Global Regulatory Affairs Health is looking for champions who care about quality and who take safety seriously. We need this process to be understood and at the forefront of our compliance work in all markets, which is why we need a network of CCDS champions. This network of talented individuals will boost the profile of the process, make us more flexible and able to quickly deliver safety updates in times of need. They will deliver the required training to LRA teams and help ensure that we are always audit ready. Each champion will bring a unique perspective and knowledge of markets and brands to inform and shape the process, giving LRA a louder voice and a seat at the table from day one. The Champions Network will help us break down the invisible geographical barriers and work more effectively to keep safety at the forefront of everything we do. At RB, our regulatory teams are simply amazing. So let's think big, let's be disruptive, and let's be the best that we can be. Join us as we go above and beyond.